All right, chapter 26. The main one that is a greatest hit for this chapter, I mean, all of it's important, but you really want to know erythropoietin. Erythropoietin or epigen, procrit, those are their main names, but erythropoietin, of course, stimulates RBC production, right? And so we're giving this a lot with our renal patients as well as patients who have anemia. And so look at erythropoietin and know that we're monitoring the hemoglobin levels to make sure we get it to the right point. And so this is administered sub-Q, IV bolus. Don't agitate the vial. Normally we're given this 3 times a week, but you might have it once a week if you have chemotherapy, but 3 times a week is pretty normal is what I see. And so remember, we're watching for that hemoglobin to go up, that hematocrit to go up. And so there are ones that are weekly or monthly, but remember, epoietin, important. Whenever you hear epoietin, associate it with RBCs. Filgrastim, which stimulates bone marrow, primarily just remember that we're monitoring the CBC because we're trying to stimulate WBCs, right? So it's good to know. And then thrombopoietic. Side effects for that are what I always remember: fluid retention, cardiac dysrhythmias, allergic reactions. So keep in mind that those, and of course we're watching for the platelets becoming therapeutic, greater than 50,000. And so just know that epoietin, RBCs, the other two, know what your therapeutic target is, and you will be doing great. And so without further ado, let's go on to blood products. And so chapter 27 talks about the different types of blood products. I'm going to tell you the main thing we're hanging on the floor is your PRBCs, your packed red blood cells. And so we're giving this for severe anemia, which means the hemoglobin is less than 6. And know with any of these blood products, the acute hemolytic reaction and an anaphylactic reaction are things that we're monitoring for as nurses. Remember I talked about diphenhydramine. Sometimes we're going to be pre-dosing that diphenhydramine for these patients, and we monitor them very closely as they're getting drugs. Drug products, too, are very much regulated on the unit, where you need to have 2 RNs check the tag to make sure that the patient is typed and crossed correctly, and that it's the correct blood product at the correct rate. And so we really pay attention to blood products. So look at the adverse effects and know that if there is chills, fever, back pain, tachycardia, tachypnea, hypotension, you're going to stop the transfusion immediately and notify the provider. You are the nurse. Stop the infusion. And you're going to watch for other signs and symptoms that we're going to have to take care of. We're also going to watch again for circulatory overload. Remember we talked about fluid overload the other day? This is where you have your cough, shortness of breath, crackles, hypertension, distended neck veins. So keep in mind to look over what you as the nurse need to know. You get your baseline vital signs at the start of transfusion. You monitor them every 5 minutes for the first 15 minutes, and then thereafter, according to policy, which typically is about every 15 minutes to half an hour, until the transfusion is done. Now, the great NCLEX question is, what do you hang? What can you hang in that IV fluid to maintain patency? 0.9 normal saline is the only thing that can be hung with a blood product. So you'll prime the IV tubing with 0.9 normal saline, then you'll hang the blood product. And remember, you need to have that large bore needle because we don't want to lyse the cells. Now this is where we're starting to cross over into some of the things I told you before. Overload. I'm just reading through. Is there anything else that I missed with this? Just keep in mind that we're watching for fluid overload and allergic reaction and other type of reaction. Woo! That's Unit 5. We're going to go through the rest. Talk to you soon.